What would our region look like without Waterloo Regional Homes for Mental Health?
Without Waterloo Regional Homes, there would be a lot of people who are without anywhere to be, without a home that they feel proud of.
A man sits hunched in an alley as people walk past.
The other thing that I think our community would notice without Waterloo Regional Homes would be more people who don't have anywhere to go, more people that are on the street.
The man holds out a cup and a passerby drops coins into it.
And tell anybody, in all honesty, that I've had the best thing to a normal life that I know I would not have had without this agency.
You look at other communities and they'll say, well, we don't have a Waterloo Regional Homes. And I think that's terrible. You know, not to have a place like Waterloo Regional Homes that cares about proper, decent housing for people who are struggling to get better.
Waterloo Regional Homes for Mental Health employs a recovery-centered approach to supporting people with mental health issues.
Two men walk down the sidewalk together.
We focus on enhancing independence through affordable, appropriate housing. We encompass long and short-term support, crisis respite, outreach services, practical living support, community involvement, and advocacy. We believe in improving people's quality of lives by respecting a person's needs, rights, and choices.
A staff member is speaking on the phone in her cubicle.
The turning point with that came when I had my first visit with my support coordinator. They respect me as a human being with regard to my mental health issue, but not solely because of my mental health issue. I'm a human being first, and I would remind someone who's considering being connected with the agency that they're being connected with an agency that values them for being a human being.
The recovery approach is a process. It's a journey that's designed by the individual and done at their own pace.
A man stands at the sink washing dishes.
Recovery is accepting a person for where he or she is at and at the pace in which he or she will move forward. Individuals are supported in their efforts to learn how to express feelings, define their self-care techniques, take responsibility for oneself, and to set personal goals.
A woman places a blue recycling bin on the curb and walks back to her house.
I know I more than likely will not win the Lotto 649, but I consider myself a jackpot winner. When I am connected with this agency, I know that a lot of things are possible. And I'm more than back to normal. I'm back to being happy. And I am a very fortunate man to be connected to this agency.
When I started with Waterloo Regional Homes, I was on maximum medication straight out of the hospital. And we gradually, with my support worker and with my doctor, reduced it so that I'm looking forward to very shortly being on the minimum dosage.
A woman and her support worker walk on the sidewalk.
I've gained the confidence to make new friends, and I've gained the confidence to start doing more things on my own.
A man sits in a chair reading a magazine. Crisis respite.
In a calm, safe environment, individuals experiencing a psychological crisis or who need a respite stay find support while working on issues related to their present situation. In partnership with Dinara Homes for Recovery, an 8-bed crisis respite provides 24 hours, 7 days per week support by staff that help by listening to the individual, connecting them with other resources, and offering support for activities of daily living. The program also provides caregivers with short-term care relief. While a family member is at crisis respite, the caregiver takes a much-needed break to re-energize themselves with confidence that their family member is being well supported.
Crisis respite is a nice, quiet place to relax. When you need a break, you need someone to talk to. You can talk to staff at any time. They have resources there and information that can connect you to their support. It's actually kind of like a comfort feeling knowing it's there, and if I'm struggling, I don't need to go to the hospital.
If we didn't have crisis respite, there would be a negative impact on the entire system. It could be the hospital, it could be the mobile crises, it could be doctor's offices or family members that people don't have the opportunity to get away and sort of deal with their own issues, and it sort of would cause a lot of pressure in other places.
Staff.
The staff are genuinely caring for the people that they support, and they work hard to make sure that everything is in place. They just are fantastic people, and I don't think I've ever met a more caring group of people in a really long time.
All the staff are beautiful. Like, I'm not just saying that they're all good, great, fantastic.
They know just what to say to make you feel better.
A man and his support worker smile as they watch a computer screen. Valued feedback.
They actually give surveys to their consumers and their family members, which means that they hold with high regard that consumers matter and that they have a very powerful voice and a role to play in this agency.
We have the capacity to help more people through our assertive community treatment team, which provides outreach services, individualized treatment, rehabilitation, and support.
We kind of like to think of ourselves as kind of a hospital without walls. We have nurses, we have social workers, we have recreation therapists, occupational therapists, we have a psychiatrist, peer support worker, an addictions specialist. So no matter what the consumer is facing, we have someone that's a specialty in that area. Going into hospital can really disrupt their lives. Their routine is different, and their social supports are different.
We have kept people out of the hospital. Some people that have been in and out, we've kept out for a long time.
I know that I have a reason to get up every morning because of the outreach, especially.
What outreach does is we provide short-term support to vulnerable individuals in the region of Waterloo. A lot of times consumers have immediate needs that need to be addressed within a short period of time. Consumers can gain access to outreach supports in a short order. Outreach is often the first contact that a person will have with Waterloo Regional Homes for Mental Health. We help people where they need to be helped.
We share a lot with our workers. They do care. The sense of kind of family here is wonderful.
There is no one who is not touched by mental health. And yet in our society, we are so stigmatized and stigmatizing of people who struggle with mental health issues. It's just, it's inconceivable, really, to think that we don't understand and that we're not really working the way that Waterloo Regional Homes is to make affordable, decent, wonderful housing not only available, but doable.
A man walks up to and consults a bus schedule. Making a difference.
We are making a difference. By fulfilling the basic need of shelter and lending human support, people's lives are changed for the better.
A man sweeps his floor with a broom.
When I moved into my new house, I had nothing, not even towels. And the worker was so helpful and understanding, and she made sure we had everything we needed when we moved in. And I couldn't have asked for any better help.
One particular piece of mail arrived for me. What this piece of mail was a birthday card, and it was from the agency and signed off by my support worker and her colleague. And I receive one every year from them. That particular first one, though, was a big deal to me because it validated my birth, the fact that I exist. And that was something that they chose needed to be celebrated. So that idea was implanted in my mind that I did matter. Again, not because of my mental illness, but because I exist, period, that I came into this world. And I've kept every birthday card since.
Perhaps the strongest testament to Waterloo Regional Homes for Mental Health lies in these words.
I can tell you with all honesty that Waterloo Regional Homes for Mental Health will respect you as a human being, and your chances of having a normal life start when you walk through these doors, when you connect with that support worker.
I didn't trust anyone to know my symptoms and to know what was going on in my head, and now I'm able to express my feelings.
If it wasn't for the organization now, like Waterloo Regional Homes and the hospital, yeah, I wouldn't be here.
Waterloo Regional Homes for Mental Health is making a difference in our community. For further information, please call 519-742-3191 or visit us at www.waterlooregionalhomes.com. By working together, we can change lives.
Funding for this video provided by the Waterloo Wellington Local Health Integration Network.